I'm going to cover about 5 articles on Paxlovid. I'm going to quickly flip through the titles. This article on free access to life-saving COVID treatment is ending. Here's what to know. This one titled, Pfizer jacks up price of 5-day course of COVID drug Paxlovid to $1,400. This one titled, Pfizer more than doubles price of life-saving COVID-19 medication Paxlovid as US transitions out of pandemic phase. And then 2 articles with the same title here, Pfizer to price COVID drug Paxlovid at $1,390 per course, where the federal government has announced the end date for free access to COVID-19 treatment, where Paxlovid will be shifted to the commercial market by November, with December 15th as the final date for providing coverage to insured individuals. The sliver of good news is that under the agreement with Pfizer, the drug's manufacturer, the U.S. government will facilitate continued access for uninsured or Medicare and Medicaid beneficiaries through 2024. And Pfizer says that they're going to run a patient assistance program for the uninsured or underinsured from 2025 to 2028, alongside a co-pay assistance program for commercially insured individuals until 2028. What this means, we don't really know. And for people that are still operating off of the initial information, where Paxlovid could be prescribed to people over 50 years of age, or who have significant risk factors like immunocompromised people, this has since been revised within the past year, so that Paxlovid can be recommended for anyone over 12 years of age. However, there are some things that can stop you from getting Paxlovid, such as if you have a dairy allergy. You have to be above a certain weight limit, I think 96 pounds. So even though everyone above 12 can have it, not everyone can get it. So initially, Paxlovid was prescribed at $530 per course, so for the 5-day treatment paid by the U.S. government, which meant it was free to patients during the pandemic. It will now be listed starting in November at $1,390 for a 5-day course, and that is 2.6 times higher than what it initially was, where the spokeswoman from Pfizer is saying that the pricing for Paxlovid is based on the value it provides to patients, providers, and healthcare systems due to its important role in helping reduce COVID-19 related hospitalizations and deaths. So that's why it's going to be priced so high in the commercial market. But to sort of underpin the ridiculousness of this, Pfizer's German partner BioNTech received a $445 million grant from the U.S. government. So it's really thanks to our tax dollars that we even have this treatment in addition to the vaccines as well. And importantly, doctors, health experts, and patient advocates have raised concerns that a higher price will curb access to the life-saving treatment, which has been shown to reduce the risk of severe disease and death from COVID. And while we don't currently know how much people with insurance will have to pay for this higher jacked-up price for Paxlovid treatment, it is very likely that health insurance will likely not cover the full amount, which means that the free treatment will now in November have a copay associated with it. How much that is, we're still waiting to see.